So blood pressure is exactly what it sounds like. It is the force exerted by blood on a vessel wall or heart chamber, because they also do measure the ventricular pressures as well. Because the heart contracts and then it relaxes, there's two numbers to it. So remember, systole is contraction, and we're talking about the ventricles, so that is when blood is being ejected, and when it leaves the heart, it is slamming against the walls of the vessel, so it's the highest pressure. Ideal blood pressure is below 120 millimeters of mercury for an adult. That's the systolic pressure. When the heart relaxes, so when it's in diastole, and both the atria and the ventricles are relaxing at the same time, those elastic arteries recoil and are still responsible for the pressure that is in the vessels, and that lower pressure is called the diastolic pressure. The target for an adult is below 80. So 120 over 80, so below that is a normal blood pressure for ages 13 and up. There's a calculation called pulse pressure, and that is just the difference between the systolic pressure and the diastolic pressure. And so ideally that's 40, right? So 30 to 40 is an acceptable range. When these pressures start to get closer together, so narrowing, it is often indicative that the systolic pressure is getting closer to the diastolic pressure, because it can show left side, left ventricular heart failure. Okay, so decreased left ventricle functioning. Usually you'll see a narrowing in that pulse pressure. As people age, often though, what you're going to see is a widening. So a widening of this pressure, and that's usually because people get hypertensive. So this number goes up, and then the vessels get less compliant. They get stiffer with age, so arteriosclerosis, so you don't really get that recoil. Okay, my mom, bless her heart, miss her a lot. She had hypertension, and so you monitor your parents' blood pressure, see how they're doing, and her top number, of course, went higher and higher as she got older, and that just occurs with people. Her bottom number was nice and low, got lower, so she had a bigger gap. But she goes, well, my bottom number is good, because she didn't like taking her medicine. But yeah, okay, that has to do with the walls and that recoil, right? So of those elastic arteries. So you see that commonly in people that have hypertension, so high blood pressure. Another very significant medical measurement is something called mean arterial pressure. The mean arterial pressure is the average pressure in the system, so in the arteries, the average force that is going to drive blood to the tissues. The reason you can't just go, well, mean, if that's kind of like the average, right? Can't we just take 120, and 80 and go, well, it's got to be 100 millimeters of mercury, right? No, of course, it can't be that easy. Reason being, though, is that the heart is in diastole for a longer amount of time than it's in systole. Okay, so it's not even. So they come up with a formula to calculate mean arterial pressure, and we're going to do it in lab, so we get some practice. And so that is the diastolic pressure. Is that the top number or lower number? Diastolic. Bottom number, right? Plus 1/3 the pulse pressure, which we just learned is the difference between systolic and diastolic. And so that gives what's called mean arterial pressure. A range of 70 to 110 is considered normal. You're really going to worry when it drops. You don't want to hear low mean arterial pressure, because that means there's not enough average mean force in the tissues for perfusion. And what did we say perfusion was? I love it. Yeah, yep. Blood is going to the tissue. I like it. A lot of people are doing like hand motions. Yes, blood going to the tissues. So if there isn't enough force to make sure that blood goes to the capillary beds, you get that bulk drop off, what you're going to get is tissues with ischemia, right? So low blood flow going to the tissues, hypoxia, so low oxygen in the tissues, and then also just overall blood hypoxemia. Okay, so all those are bad. All those are bad just means tissues are not going to get what they need. Okay, so 60 millimeters of mercury for a mean arterial pressure is required for organ functioning, because when organs don't get blood, they die. Okay, you get organ failure. You also don't want it to be too high. So a high mean arterial pressure is too high. It can be damaging to the heart. You can get stroke. And so there are strokes due to blood clots. There are also strokes due to bleeds in the brain, so red stroke. And then when it's over 160 millimeters of mercury, you can get cerebral edema. So cerebral, so in the brain, edema means swelling. Okay, and so you don't want it to be too high either. Okay, so too low, you get organ death. Too high, you're risking some damages. All right, so those of you that are going to be working in hospitals, this, if you've ever looked at a monitor, there's the mean arterial pressure. Okay, they calculate it for you. So that's there. And like I said, you just want 70 to 110. You want it in that range. If you watch a patient's mean arterial pressure drop, you know, that's not good. Like I said, you're going to get organ failure. When you feel a pulse, you're feeling that difference between systolic and diastolic pressure. You can use pulse to count heart rate, and we learned about acceptable heart rates between 60 and 100 is an acceptable range. 75 is usually the average of the heart rate at rest. The strength of the pulse, sometimes it's difficult to feel a pulse, so that strength of the pulse is basically that strength of ventricular contraction and cardiac output. There are pulse points. They're on the lab list, so when we flip to that, we'll look at that. But pulse points are where, remember, arteries are normally going to be deep, because when they get cut, we get spurting, and so it's in our protection that most of them, they're deep, except in certain places. So when they are superficial, and usually there has to be a bone or some tissue to sort of feel the pulsing against, those are our pulse points. And so temporal artery, facial, common carotid, brachial, radial, femoral, popliteal, posterior tibial, and dorsalis pedis. And so those are on the lab list. We'll practice those. Some of those are going to be a take-home lab. They're a little personal. Find a loved one. It can be a very romantic date night. I got to study. I got to study, babe. I got to feel all these pulse points. So just, you know, think of that. Measurement of blood pressure is done using a sphygmomanometer. I know that's a blood pressure cuff. It's a lovely word. And a stethoscope. And so we're going to learn how to do that. Smooth blood flow makes no sound. So while we are using a blood pressure cuff, we are going to constrict blood flow, and then we're going to slowly allow blood flow. The sounds that we will be listening for are called the carot cough sounds. Usually this is going to be done on the brachial artery, which is the arm. So the upper part of the appendage, the lower part is the forearm. So some of you, I know how to take blood pressure, but you probably all had your blood pressure taken. So the first thing is the cuff squeezes, right? So there's no blood flow at all. So at this point, it's going to be silent. Then the pressure is slowly released until blood starts to flow. When there is just the initial trickling of blood, you'll start to hear the first thump, and it'll sound like you'll hear the heart beat. And so that first sound is going to be indicative of the systolic pressure, so that top pressure. Then there'll be a time so it's flowing, but it's still constricted, and so you hear the heartbeats. It's going to get louder in the middle, and then that cuff is getting looser and looser and looser, and then it's going to get quieter and quieter. And the last heart sound, so right before it gets smooth blood flow, is called the diastolic pressure. So smooth, unrestricted blood flow doesn't make a sound either. So if there's no blood flowing, no sound. If it's smooth, unrestricted, then that doesn't make a sound either. And so that's how blood pressure is taken.